Right, and this is an India Today news break. As far as the poisonous syrup is concerned, what we're hearing from the centre is this. The government, the Union Health Ministry is blaming Tamil Nadu government for cough syrup deaths. Sources are telling us that centre is now blaming the Tamil Nadu FDA. Sources indicate that the Union Health Ministry has now said that the Tamil Nadu government is to be blamed over the cough syrup controversy, and the following information is what we have received. The hint is that Tamil Nadu FDA's responsibility to ensure checks and balances of a manufacturing unit, Form 25 or license to manufacture common formulation allopathic drugs is given by state drug controllers and are governed by them. CDSCO is already recommended, which is the central body, by the way, to put this into perspective for our viewers. The central body, the CDSCO, had already said that there has to be cancellation of the license for the firm in question after a DEG presence in Koldrip was confirmed. This has to be done by the state drug controller. Essentially, this is what we are picking up from our sources. The central government here has said that the onus now is on the Tamil Nadu government. The CDSCO has already recommended the cancellation of the license here, but it is to be done only by the Tamil Nadu government. Milan has more on that story. Milan, here, the CDSCO, the government says, at least through our sources, that has recommended cancellation of the license, but but they are also saying that the Tamil Nadu government should have done it. But this comes, this sort of an action suggested by the CDSCO comes, after previous instances were also recorded by the same firm, isn't it? It's not the first instance. So they have some answering to do on that front as well.
Well, Sneha, this pertains to, of course, the syrup that was made by Srishan Pharmaceuticals, and it's a Chennai-based company. So, therefore, the state drug regulatory authority was responsible to do the checks and balances that they have not done. Of course, this is a hint that we are getting from sources in the Union Health Ministry that's saying that we'd already told them to, not issue licenses to such people for non-compliance. But, of course, what is being said here is Form 25 or license to manufacture common formulation or allopathic drugs is given by the state drug controllers. And this is a POV for every company that is manufacturing cough syrups throughout the country. Now, the onus lies on the state, which is why in the meeting that was held with the Central Drug Controller Authority as well as the state, which had joined from various parts of the country, Tamil Nadu Drug Regulatory Authority had informed the centre that they are looking at checks and compliances and everything is on paper as per them. But of course, there have been apprehensions, which is why the Union Health Ministry is saying that states like Tamil Nadu must ensure that checks and balances are in place, and all these details and the responsibility of manufacturers to manufacture cough syrups with the prescribed fixed dose combination is also on the state. So to blame the Union Health Ministry for each of these issues is also not correct, because everything comes under the concurrent list there, Sneha, as you know very well.
Well, absolutely. In fact, I was just about to ask you this question. It's not like the CDSCO can, wash its hands of this controversy. It's absolutely mind-boggling on how they say at this point in time that we had told the Tamil Nadu government to do it. It was their drug regulator who had to do it. But what about the role of the CDSCO? I mean, at the end of the day, you're not getting an upset tummy or some sort of an extreme drug reaction. It's death for our children, Milan. This is what we're talking about, and it's happened in the past as well, is what I really can't wrap my head around, isn't it?
Well, definitely, the last time that it had happened, and we've discussed this over the deaths of children in Gamibia as well as in Uzbekistan, where cough syrups and Indian manufactured cough syrups were being sent over there. And of course, the death toll of both these states, Madhya Pradesh as well as Rajasthan, both fixed dose combinations are different from each other in both these states. But the fact remains that, of course, at the facility where the manufacturing is happening, checks and balances are not taking place. And the first point of insurance should come from the state regulatory authority. Had these checks happened periodically, then such a state would not have arisen. But of course, the onus lies on the centre as well. You are the central state drug controller, and the kind of checks and balances that should percolate right from the top to the bottom have also to be taken into consideration, which is why regular meetings should be taken with the state drug controller. A central team should go to states to do regular checks and cross-checking, and all that will only be possible once seriousness is shown in terms of how medicines are being manufactured in what we call the pharmacy of the world. And this is highly embarrassing for a country that's actually looking at exporting these medicines across the country and
Absolutely.
outside as well. Sneha?
It's a big question that the central government has to answer as well. It's not just the state government. I mean, this company was in news for the wrong reasons. And the state drug regulators, of course, have a role to play, as Anaga's reports are clearly showing on the kind of facilities where the drug was being manufactured, where these medicines were being manufactured. But what about the central body? Can they say that we had recommended and the state drug controller had to do it? They did not. Now, India's drug safety system is as follows. First of all, the central body, the CDSCO, which is the Central Drug Regulatory Authority in India, it checks formula, approves drug and shapes regulation. That's the central body. Of course, we know that health is in the concurrent list. It's central as well as a state subject. So the role of the state drug controller also coming. It issues licenses, also inspects factories, which it did not do clearly in this case, as is evident, or then they look the other way, and then also test drugs, which then goes to government labs across these states. They keep on testing the medicine. Quality, sometimes random checks are done. Contamination is checked as well, and this information is provided by the state drug regulators. The inspectors also, like I said, do random batch checks. All of this is supposed to be done well if they were to follow the rules clearly, not happening in this case. The drug vigilance body tracks adverse drug reactions, and that really happens nationwide. So what really went wrong in this case is that clearly the drug regulators at the state level looked the other way, and today, like Milan has been telling us, the central government has stepped in and said that the recommendation to cancel the license was in fact made already by the central body to the state drug body here.